So our first assessment for the abdomen is going to be inspection. Our purpose is to assess for abnormalities in the shape, skin, or movements of the abdomen. So we are going to do this in two positions. The first position is going to be at the patient's side, and the second position is standing at the patient's feet. So our first step is to place the patient in the correct position, which is going to be supine. Then we are going to inspect the abdomen for a few things. First, we're going to stoop to the patient's side, so kind of at eye level with the stomach. And then after we assess for these, we're going to go to the patient's feet. We're going to move all the way to their feet, and we're going to assess it from there. So the first thing we are assessing for is contour, size, and symmetry. So when we're talking about contour, we want it to be flat or rounded. And what does that mean? So flat is going to be when you draw a straight line from the symphysis pubis to the costal margin. The stomach should basically be flat, so there shouldn't be any overlap or underlap of that line. The second thing is going to be scaphoid. This is not something we want. Remember, we want either flat or rounded. So scaphoid, if you go ahead and draw that angle, there is going to be an indent in basically the middle of it. Now, when we have rounded, this is a normal finding because when you draw that angle, you have a little bit of a lift of just the stomach. So not like the sternum or the rib area, just the stomach. So this would be like a little bit of belly fat. Then we have protuberant. Now, when you draw that line, all the way from, let's say, the sternum to the pubic area, you have a distension of that stomach, and it's out pretty far. So, to recap, we want to have a curvature or a contour of flat or rounded, and we do not want scaphoid or protuberant. So again, scaphoid distended or protuberant abdomen is usually seen with an underlying pathology such as cancer, weight loss, hernia, or accumulation of fluid. Accumulation of fluid. What is that? So that could be shown as ascites, which is an abnormal accumulation of fluid in what cavity? In that peritoneal cavity. So now that we've gone over the contour, then we want to have a normal finding of the stomach being bilaterally symmetrical. So the next thing we are going to look for is size and position of the umbilicus. So your belly button. So what we'd want is going to be the umbilicus is midline. I'm just looking through this to see if there's anything else there. So there's not. Since we were talking about contour, so we have the scaphoid, the distended, or the protuberant abdomen. We also went over ascites. So I also want to go over abdominal distension. And what can this be caused by? This can either be caused by fluid, fat, feces, flatulence, fibroids, or, if we're thinking of women, a fetus. So that will be all for our contour, size, and symmetry. We know that we want the umbilicus to be midline. Now we have condition of the skin as our third thing to assess for. We want to know the color, lesions, veins, hernias, and hair distribution. So hair distribution, as we know, should be distributed equally. Skin should be smooth and intact without any pulsations or visible peristalsis. So peristalsis and what pulsations? Aortic pulsations. may be visible if the patient is very thin. So an abnormal finding is if we have increased peristaltic waves, which are what kind of movement? It's going to be a ripple-like movement. These will be seen with what? Intestinal obstructions. So what are pulsations? These are increased with the presence of an AA, an aortic aneurysm. And then for the last portion, we have more. So for since we're talking about skin color, lesions, veins, and hernias, we have something called diastasis recti. And so this is a bulging area in the abdomen occurring with separations of two halves of the rectus abdominis muscle in the midline at the linea alba. And I believe I have a picture of this. Yeah, right here. So basically just think of from the sternum to your pubic area, if you do a vertical line, these muscles are basically going to be separated. So we also have hernias. So hernias may be visible from the abdominal wall weakness, and it causes a loop of intestines or abdominal tissue to protrude through the opening in the peritoneum. So hernias are classified according to their location, such as if they're epigastric, umbilical, direct and indirect inguinal, or femoral. And so we have that right here. So epigastric, let's say that's your xiphoid process. Umbilical is going to be at your umbilicus, your direct inguinal, and then your indirect inguinal. So those are going to be like, let's say if your V line had another V, that's where those would be. So direct is going to be on top of inguinal, and then you have your femoral. So that if you draw your V, go a few fingers underneath, and that's going to be where that is, your femoral artery. And then the last thing we have to discuss about is colon sign. So colon sign is going to be superficial bleeding under the skin, which is called ecchymosis, and it is around the umbilicus, and it may indicate what? Intra-abdominal bleeding. And I think I'm going to go into these in more detail later.